Good morning, Joslyn Center Facebook Live fans. This is Jack Newby, the Executive Director at the Joslyn Center. Hope you're enjoying your Friday and looking forward to your weekend. We have an interview coming up that we'll talk about, continuing to talk about Medicare Advantage plans. This is the open enrollment period for Medicare. Before we start talking about that, we want to cover some of the things that are happening here at the Joslyn Center in the next week. And I will get that up on my computer in just a minute. Sorry about that. I had that up and then it went away. Actually, this coming week is National Caregivers Month. And so we just want to let you know we have a couple of caregiving classes here or support groups here at the Joslyn Center. So check out our calendar at joslyncenter.org and find out about our caregiving support groups or Care Pathways, which is a class that helps you take care of yourself. And as you get older or taking care of any chronic conditions that you might have. Also to remind you, our season kickoff cocktail reception, Moon over Casa de Colson, is happening on Monday, November 7th. And so if you'd like tickets to that, it's going to be a great event, music, cocktails, hors d'oeuvres. If you'd like tickets to that, contact Greg Murphy here at the Joslyn Center at 760-340-3220, extension 107. Our next Aging Mastery coming up is on November 1st, and it's a 5-session course. It goes from November 1st through the 15th, meets twice a week. And that covers things about pre-planning, such as what we're talking about today, or learning good sleep techniques, socialization and the importance of that, exercise, fall prevention, diet. It covers a number of different very important issues to make sure that your golden years remain golden. And then Brain Boot Camp on November 9th and 16th. Again, that's a 2-session course, and it's developed by UCLA Longevity Center, and it's a research-based program. And it really gives you some great tips about brain health and what you need to do to keep your brain healthy, and also how to improve your memory. If you are interested in volunteering, please, we are entering the season. We're going to certainly need a lot more volunteers here at the Joslyn Center. So contact Judy at 760-340-3220, extension 103, to become a Joslyn volunteer. And also, we're happy to announce if you have any friends who are Spanish speaking or more comfortable with that language, our website at joslyncenter.org is now in both English and Spanish. So it's a great thing to tell your friends about, that they can check out and find out what's happening here. And we have Spanish speaking counseling in our wellness center. So a lot happening in that area. Also, Penny's Pantry is coming up on Friday, November 4th from 7:30 to 9:30, and that's free food distribution for those who are in need. So just stop by at the Joslyn Center and be sure you pick up the food you need at Penny's Pantry. So that's covers pretty much some of the things that are going on here at the Joslyn Center. Meals on Wheels, if you need home delivered meals, contact Bob at 760-340-3220, extension 110, and we'll be sure that we take care of you there. So today we're going to, as I mentioned, we're going to talk about Medicare. This is the open enrollment time, and we have with us this morning Avon Hall, and Avon is with Alignment Health Plan, and he'll be joining us in just a minute. So Avon, come on down. Okay, while we wait for Avon, I see. So we had a little technical difficulty there. Avon will be joining us in just a moment. There you are.
Hello, everyone.
So tell us a little bit first, Avon, about you, your background. People like to know who we're talking to. So tell us a little bit about you.
Okay, well, my name is Avon Hall. I live here in Southern Riverside County in the city of Menifee. I'm a California native. I have actually been working with Medicare since 2006. So with the inception of the Part D prescription drug plan, that was the beginning of my Medicare career. I've worked for some other insurance carriers, currently employed with Alignment as a community outreach representative. I cover both Riverside and San Bernardino County.
So for people that are signed up for Medicare, that are receiving Medicare, or maybe new and need to sign up for Medicare right now, this is what's called the open enrollment period. So could you explain a little bit about that?
Certainly. So each year from the dates of October 15th through December 7th is called the annual election period, also known as AEP. And that's the time for folks to shop for different plans if they're not happy with what they currently have. It's important to basically do a prescription review every year just to make sure that your prescriptions are, the cost of your prescriptions aren't going up if anyone is taking prescriptions. So that period is what we're in right now. You would join a plan. That plan would then become effective January 1st. So the plan would be available for use January. If someone makes a change and they're not happy with that plan, they would then have until March 31st to go ahead and make one final change to get into a plan that's going to meet their needs.
So why don't we do a little bit of, we'll call it Medicare 101, because there's Part A, there's Part B, there's Part C, there's Part D, and what all those things mean.
Right.
And so sometimes we think we know what we're talking about, but people that are new to Medicare may have no idea.
Okay, so we'll start off with the letter A. Now, Part A of Medicare covers your hospital, home health care, and hospice. You basically, as we work, if you're getting Social Security deducted from your paycheck, you would need to work at least 40 quarters, which is equal to 10 years. At that point, you are entitled to your Part A. There is no premium for that. Now, for those that have not reached the 40 quarters, or if they are, let's say they're new to the country, they could purchase Medicare Part A, and I believe the premium is somewhere around $485 per month. So that's Part A, and your options there. Part B is going to cover outpatient services such as doctor visits, labs, x-rays, all that sort of stuff. With Part B of Medicare, there is a premium. Now that premium has been going up every year. 2022, the premium was $170.10. For 2023, the premium actually went down. So it's going to be $164.90. Now, everyone pays that. That typically comes out of your Social Security check before they send it to you. You do have options to pay it differently. If someone qualifies for low income subsidy, which is income based, the state could in fact pay for that Part B premium for those individuals. So that's something we help folks determine as well. Now, Part C of Medicare is not actually a coverage, it's a choice. So in Riverside County, San Bernardino County, just about any Medicare Advantage option, or any other state rather, it's a choice between an HMO, which is a health maintenance organization, or a PPO, which is a preferred provider organization. Now, with Riverside County, there's only one PPO available. You can look that up on Medicare.gov if you're interested, or ask someone if they can let you know what plan that is. So that's Part C, again, not a benefit, but a choice. And then Part D is prescription coverage. So with Part D, you can get that together with a Medicare Advantage plan or separately, depending on how you want your healthcare to work. Part D by itself has a premium, but basically it's going to cover prescriptions at a lower cost than they would be retail. Part D has a tier system, typically tiers 1, 2, 3, 4, and 5. Tier 1 is going to be your generic, typically 0. Tier 2 is also generic, but there are newer generic medications that haven't been on the market very, very long. And there is a copay of $5 or perhaps 0 for some of those. Tier 3 is going to be brand name, usually $45, $47, depending on a plan. And then tier 5 is going to be specially compounded medications or injectables. So that's the most important part of your Medicare plan would be prescriptions. You go to the doctor, hospital, it's usually going to be a 0 copay. But if you're filling prescriptions each month and you're paying money for those, that's when you'd want to reach out and see if you can find a plan that's going to meet your needs a little bit better for your prescription costs.
So we refer to, or here referred to as traditional Medicare, and that's Part A and Part B.
Correct.
But the thing with Part B, if you're on traditional Medicare, it only covers 80% of the reasonable and necessary costs, I think is the term.
Correct. Yeah.
And sometimes that can mean some pretty big out-of-pocket costs.
Correct. So 20% on a doctor bill, not so much, but if it's an outpatient surgery or some type of procedure, then that could be quite a bit. And there's no maximum. I mean, it's 80-20, and that's pretty much how that works.
And so there is available, if people want to do that, they can get plans that will help cover some of that, but that's just another cost.
Correct. So folks that want a little freedom, let's say they have a home in another state, or they just want to stay with traditional Medicare, they could purchase what's called a Medicare supplement. And those get a little tricky. There's different letters available that offer different coverage and benefits, but those are available anytime during the year. There is no enrollment period for a Medicare supplement. And depending on how you want your healthcare to work, that is also an option or a good choice for folks.
Now, one thing that caught my interest when you were talking about Medicare Part C or the Medicare Advantage plans,
yes,
is that there's a premium for that automatically taken out of people's Social Security checks.
Correct. For Part B. Yes, sir.
For Part B, yes.
Mm-hmm.
What interests me, because I kind of look around and see what's out there on Social Security, and they say no premium. So is that no premium or no additional premium?
Correct. So it's no additional premium. So the $164.90 is the Part B premium. The Part C plans have 0 premium. So your Medicare Advantage plans, with all the competition, and there's so many plans out there, that just driven the prices down to 0. That happened several years back. One company went to 0, and the next year, all of the other plans seemed to follow suit to remain competitive.
Now, the other thing that isn't covered in Medicare is vision, dental, I think hearing aids. So
correct.
There are some Medicare Advantage plans that cover those things.
Correct. And some of them cover more than others. So again, that's something you'd want to look at in detail if you are interested in those benefits.
Okay. So tell us a little bit about Alignment Health Plan, because I think we know about all the big names out there, but Alignment is I think fairly new to this area, or at least I haven't heard.
Well, in terms of Medicare companies, they are relatively new. They started in 2014. They are a publicly traded company. We have a 4-star rating. We are in North Carolina, Texas, California, and Nevada, I believe. So we are growing. The company's growing. It's expanding. The benefits are very competitive. I'm not going to go into detail, but definitely check Alignment out. And like you said, there's always the big names you hear every year, all the time. And sometimes good plans get looked over with all the chaos going on during open enrollment.
So if someone wanted to find out about alignment, how would they get in touch with you?
Well, they could call me directly. We do in-home appointments. We also have several seminars set up throughout the valley, throughout Riverside, San Bernardino. I do respond to email and text. I can give that now if you'd like. If
Sure.
anyone wants to jot it down and give me a call. So my phone number is 951-260-9024. My email is the letter A and then my last name, Hall, Hall, at ahcusa.com.
Okay, why don't you repeat that phone number one more time in case
Sure,
you didn't have a chance to grab a pen or pencil?
Okay, so 951-260-9024. And the email ahall@ahcusa.com.
Now, when someone's preparing to make an appointment with someone like you or someone else to talk about and they're interested in a Medicare Advantage plan, what should they do to prepare for that appointment so they get all the information they need and the person they're talking to, that they can take care of everything as quickly as possible?
Right. So you want to know, of course, who your primary doctor is. We'd like to know any specialists, if anyone's seeing a specialist. You'll also want to have a list of medications available, because that's the most important part of it. We can determine what tier your medications will fall in, therefore giving you a price for your prescriptions. Your Medicare card, which is red, white, and blue, it's got some letters and numbers mixed together. And then the effective dates for your A and B, which would be needed for the enrollment if someone did decide to go ahead and enroll.
So those are important things, and I think sometimes people don't think about it, or if they're on the spot, they don't remember all their medications.
Right.
So it's best to write those things down. And also, if you like your doctor, but there are some things you don't like about your plan, you want to make sure you're able to continue seeing that doctor.
Correct. And we are affiliated with most of the providers there in the desert area. And our plan, like I said, the plan is very competitive. We actually do a rebate plan as well. So the $164.90 that they're deducting from Social Security, we have a plan that actually gives the member that money back on their Social Security check.
Well, that sounds like something to look out for, especially with inflation and everything. People are getting pinched a little bit financially, so that's something to really look forward to. Well, Avon, I really want to thank you for joining us this morning, and I think it's important for people to learn about Medicare. We kind of think about it and maybe take it for granted, but it's a pretty complex system. And it's important to learn as much as we can about it. So I want to thank you. Again, one more time, that phone number where people could contact you.
All right, 951-260-9024.
Okay, again, thank you for joining us. I hope you have a great weekend. And also to our viewers, hope you have a great weekend. And please join us next week. We're going to do Interview Friday on Thursday, because there is a very special event coming up next Friday that we're going to have to do a slight adjustment on our schedule. So everyone have a great weekend. You have a great weekend, Avon. And thank you for joining us on Interview Friday.
All right. Thanks, everybody.
Okay. Bye.
Bye.